Hi, my name is Elrika Hugo and I'm a social worker at Tara Hospital. I am going to talk a little bit about eating disorders and I'm going to give some tips on how to identify an eating disorder or some risk factors that we need to look out for, and I will give some tips on how do we approach somebody that we suspect might have an eating disorder. So I think just back to the basics, if we think about a very informal definition of eating disorders are serious mental and physical illnesses that involves complex and damaging relationships with food, eating, exercise, and body image. And if we then look at a more clinical textbook definition, eating disorders would be characterized by a persistent disturbance of eating or eating related behaviors that results in the altered consumption or absorption of food that significantly impairs physical health or psychosocial functioning. The three eating disorders that we mainly see and work with is anorexia nervosa, bulimia nervosa, and then OSFED, which stands for other specified feeding and eating disorders. So if we think a little bit around the facts of eating disorders, I would just like to specify a few. It's important that we know that eating disorders do not discriminate, and they are observed in people of all ages, racial or ethnic backgrounds, body weights, and genders. Eating disorders onset typically occurs during adolescence, or we would see it in young adulthood, but it's not limited to these life stages. There's no distinct cause of eating disorders. However, research has found a number of genetic, biological, behavioral, psychological, and social factors that can increase the risk of eating disorder development. Eating disorders can be life-threatening and have the highest mortality rate of any mental illness. While eating disorders do not have a miracle cure, there are numerous evidence-based practices proven to support eating disorder recovery. So if I go to the risk factors for eating disorders, it would include biological. We would look at your gender, and we've just now specified that it does not discriminate, so it does include both male and females. Genetic susceptibility, we would look at your genetic vulnerability if there's any family history of somebody who had suffered from an eating disorder. And then again, we would look at the onset of puberty. Often we would see in our adolescents that they really struggle with this transition. They struggle with the changes within their body, and that's physically and emotionally. If we then look at psychological risk factors, we would typically look at low self-esteem, high levels of anxiety and depression, the feeling of out of control, and then again personality traits such as perfectionism and obsessive compulsiveness. We would also look at trauma, whether it's any childhood traumas. This might include changes in environment, moving house or schools, divorce, or any sexual trauma. Sociocultural risk factors, we would look at whether kids or families are attached to the ideal of being thin. We would also look at the pressure that society puts on us to achieve and succeed. The involvement in any sport or industry that has high emphasis on a thin body shape and size. For example, a model or being an athlete or a ballet dancer. We would also look at kids who are more susceptible to peer pressure. And then teasing or bullying could also be a risk factor, especially if it's based on that child's weight or shape. And then again, we would look at troubled family or personal relationships. We would identify certain dynamics. And then if we think about some helpful tips when talking to somebody you suspect may have an eating disorder, we always encourage to try and use the I statement. This means, for example, that you are going to communicate things like, I care about you. I'm very worried about you. And then you would also help them to feel safe to talk about these difficult behaviors or feelings. So create a safe environment for them to talk. Ask them how they are feeling instead of just assuming that you know what they are feeling. Give them some time to talk about these feelings, identify, explore, and probe. Listen respectfully to what they are saying. We always speak about looking for the underlying message. Encourage them to also seek the help that they need to get better. And then some tips in terms of what we want you to avoid is avoid putting the focus on food. Try talking about how the person is feeling instead. Do not use blame. For example, instead of you are making me very worried. Try the I statement. I am very worried about you. Then avoid taking on the role of a therapist. This is very important. You do not need to have all the answers. Rather, it's most important to just listen and create a space for kids to talk. Then also steer away from manipulative statements. For example, think about what you are currently doing to me or what you're currently doing to yourself and others. This is not very helpful. Lastly, I would like us to just think about the 8 silent signs of eating disorders in children that we often miss. Number 1, it would be abnormal weight changes that you identify within your child. Avoidance of family meals, so they no longer want to have dinners, for example, with you. Adoption of a specific diet or meal plan. Missing food in the home. Increase in physical activity that's more excessive than usual. Increased focus on appearance, and then change in demeanor. Usually become very irritable or isolate themselves. And then lastly, it would be spiked interest in cooking, but not with the focus of eating that meal. Think about preventative work, and the earlier you can catch an eating disorder that emerges, I think the better the outcome of recovery is. So thank you very much.